This is Matthew. Matthew is our lead physical therapist at St. John's. And so, Matthew, before we begin, just tell me a little bit about what a physical therapist is.
I think we're involved in normalizing movement would be the easiest way to say it. So we'll look at people who are in pain or who have joint tightness or who have muscle weakness, and we analyze the defects that result from that and try and normalize the motion using various exercises and modalities.
Mm-hmm. So it's mostly a movement-based type of treatment?
Movement-based, and then we can use modalities like ice ultrasound for pain.
Yeah, I would say that the key treatment protocols after joint replacement involve both medication but also physical therapy. So it's one of the three legs of the stool of a successful surgery. Tell me a little bit about what a physical therapist, or how a physical therapist trains and becomes a therapist.
My training was about 3 years. It involved kinesiology, physiology, biology, biomechanics. Initially, probably in the first year, I think I said anatomy, obviously, and then you go on to learn the treatment techniques specifically.
Sure. Yeah. So we've been working together for almost 12 years now, and we deal with the body differently. I typically deal with disease when a person goes bad. You guys know a lot more about wellness than I do, and body movements and transition and connective tissue. So I wanted to just pick your brain a little bit about some of the essentials or the frequently asked questions after joint replacement. What are some of the common questions you get asked about joint replacement?
I think one of the most common questions would be, what should my activity be when I get home? How soon can I progress and go to the gym? And then after that, how soon can I progress to horse riding, skiing, and any other activities like that? So we start by advising the patient, when you go home, your activity is going to be similar to what it is in the hospital. You'll increase your walking by a few minutes every day within the tolerance of your pain. But the biggest questions are really activity. Can I overdo it? Can I damage this joint?
Mm-hmm. Well, let's go back to that patient who wants to know about recovery and then get back to horseback riding.
Right.
What do you tell that patient specifically?
That they should be within about 3 months doing everything that they need to do, but then the more vigorous things like skiing and or horse riding, they should be considering at around 6 months.
6 months.
Yeah, but by 3 months they should be doing everything. You know, they should be riding a bike, going to the gym, doing normal activities. Anything a little bit more stressful would probably, wait a little longer than that.
Okay. I know in the hospital there is so much teaching and training from your department after joint replacement, after hip and knee replacement. What are you teaching the patients in the first day or in the first 48 hours after their joint is replaced?
In the first day or the day of surgery, we'll teach the patient, first of all, circulation exercises, and then the next thing we'll teach them really is the safest and the easiest and the most painless way to get in and out of the bed. We'll teach them how to use a walker and the sequence of using a walker, and then if they're doing well, we will also show them how to use a cane, which hand to hold it in, what the sequence is for a cane as well.
Yeah, I know in the old days, or the older days, patients were typically on crutches for about 6 weeks, but nowadays they're on a cane by the next day.
Yeah. We'll teach patients how to use a cane on the day of surgery. Then the next day we'll continue to do that. Sometimes they want to go back to a walker. Oftentimes on the day after surgery, post-op day 1, that the pain might be a little bit more, so they may go back to the walker. But we try and teach every single patient how to use a cane before they leave the hospital.
Sure. At the same time, we also have some younger patients. You know them, very type A, very aggressive.
Yeah.
It's almost a race, and they don't even want to use the cane. They want to just start walking with nothing.
Right.
What do you tell patients like that?
But they can if they want to. They don't have to use a cane. Some patients find it actually quite difficult to use a cane in terms of coordination, depending if they're right or left-handed. And sometimes those patients will simply bypass the cane and use nothing. And we'll assess the gait not using the cane, and if they're safe, then that's okay.
Mm-hmm. In addition to the walking, the patients are often doing bed exercises from the very first hours right after surgery.
Right.
What are those bed exercises for?
Mostly for the hips and knees, we teach some circulation exercises which they can do in bed. And then for the knee patients, not on the day of surgery, but starting on post-op day 1, we'll start to teach the knee patients range of motion exercises to regain mostly flexion and extension.
Now, patients are very aware of their need to do physical therapy after joint replacement. It's one of the most common questions asked. They said, well, what about physical therapy? And we look at therapy at 3 different stages. We look prior to surgery, in the hospital, and after. Let's talk about therapy before surgery. What should that look like, in your opinion?
Well, we have, I believe that I'm actually not sure about this, but I believe the patients do go to outpatient for some pre-op teaching, and that's shown strengthening range of motion exercises and gait training. We also have the joint class, where we tell the patients what they're going to expect in the hospital. We prepare them, you will get up on the day of surgery, you will use a cane, you will be shown exercises, you will go home on post-op day 1 or post-op day 2. And that's at the joint class. We also show them how to use a cane, how to use a walker, and how to climb up and down the stairs at the joint class. So that's the pre-op training.
Have you noticed, so doing the pre-op training is a little bit of extra effort. Have you noticed that patients who go through pre-op training have any difference or even an advantage when they're in the hospital?
I think so, because they know what to expect, and then there's not the fear of the unknown. They go. It's a 2.5 hour class, I believe, and they go into a great deal of detail, not just physical therapy, but occupational therapy, case management, nursing as well. So the patient knows exactly what to expect. So there's no surprises for them. And when I've seen people who have attended the class and asked them, was it helpful? They've said absolutely.
Yeah, we've seen that too. We can see a clear difference between those who went to the class, have the information, have practiced their exercises, and how much more quickly they progress. They do. The ones that don't attend are fine.
Yeah.
But the ones that have had extra training ahead of time really show that in their movement.
Yeah.
Let's talk about what happens with physical therapy in the hospital.
In terms of
movement. Let's just start. So the patient it's post-operative day 0. They've had physical therapy. What does physical therapy look like for that patient on the first day of surgery?
So on the first day of surgery, as I said, sometimes it's a little bit more painful. So we really have to coordinate with the nurses to make sure that the patient has been medicated. And what we'll do on post-op day 1 is just a progression of what we've done on post-op day 0. We will add new exercises, we will increase the number of repetitions, we'll increase the distance walked. If we haven't done stairs on day 0, which we usually don't, then we'll probably introduce stairs, if not in the morning, in the afternoon, in preparation for them going home.
And tell me about physical therapy after a patient goes home. What does that look like?
We teach them to continue doing the exercises until the home health therapist comes, who will then progress the exercises, make them a little bit more vigorous, probably add some standing exercises and some balance exercises. They'll take the patient outside of the house to make sure that they can use a curb. And then encourage the patient, to first of all use the cane instead of the walker, and then eventually not use anything at all.
Traditionally, we have sent a physical therapist to visit with patients at home. Is that important, and is that necessary?
Yes, I think so, because the exercises we show in the hospital are fairly limited, simply because it's very acute and painful. And I think they need the guidance of how to progress, how quickly to progress, when to use the cane, and when to progress the exercises. So absolutely, yeah.
Mm-hmm. And then we've done patient home visits, mostly out of convenience, especially in the first couple weeks. But then many patients ask about progressing to outpatient physical therapy, where they're leaving the home and they're going to a physical therapy office. What is the role of outpatient physical therapy after joint replacement?
I think in the case of the knees, it would mostly be for if the patient is having some difficulty regaining full flexion or the required amount of flexion. I think as a rule, most people don't need to go. Some people want to go, particularly the athletic types. They may want to do some more intense strengthening, and as I said, the knees may need to go to get some range of motion.
Okay, but it sounds like it would be additional work and not mandatory work.
I don't think it's mandatory. I think some patients just want to go. They just want to go to get the guidance, just to be told this is what you can do at this stage, this is what you can do in another week's time. Some people like that guidance. Other people just want to make sure that they're absolutely optimizing their strength and range of motion.
Yeah, I would agree with you. I think the role of outpatient physical therapy is very patient specific.
Right.
I think you have to move, you have to exercise, you have to do your training. But some people like to do it on their own. Some people are gym people and they like to go back to the gym. Some people are trainer people, they work with their trainers. And some people are physical therapy people where they feel like they get a lot of good coaching with the therapist. So I think as long as you're moving, you figure out what your best environment is.
Yeah,
okay.
Definitely.